Welcome, everyone. So again, my name is Lad Keith. I'm an associate professor of planning at the University of Arizona, and I also direct our Heat Resilience Initiative. And today, to speak to our group, we have Dr. Heidi Brown, who is a university distinguished professor in epidemiology. And Heidi works on both vectors, so think of mosquitoes, but also climate change and increasingly multi-hazard impacts of climate change on health. And so has been very focused on extreme heat for a while, but has increasingly kind of heard the call of public health agencies that need to address multiple things at the same time, and has also done work on other climate issues as well. So Heidi's the perfect person to talk to us today about kind of the intersection between extreme heat and wildfire. And Heidi, I'll just throw out, you are our university lead for BRACE, which is Building Resilience Against Climate Effects. It's a program run through CDC that's awarded to the state health department. And then ASU and U of A are the two sub-awardees. And then also we work together on CLIMAS, which is the NOAA-funded RESA program. And Heidi is in charge of the health part of CLIMAS, and we also collaborate on the heat team. So I have a couple of different federally funded projects going on. But with that, Heidi, I'll turn it over to you to do the presentation. Thank you.
Awesome. Thank you. Thanks for that introduction. And yeah, thanks for letting me come and talk a little bit about the work that, well, most of this is the work that you and I get to do together. And thank you. I see a lot of Pima County ASU and ADHS collaborators on the call. So thanks. It's nice to see you there. All right. Um, I will go through this really, really fast because I'm just preaching to the choir here. But whenever we talk about climate change, I'm thinking not just about the what the changing climate is doing, but how that's sort of impacting, what are the implications of it. And really what is interesting to me about that, and to probably most of us, is about those health implications of the changing climate and what does that mean. And so that's really the work that I do in my lab is as we're seeing these changes, can we better understand what's going on, and can we start to predict, prevent, and understand and be prepared for it. I'm today talking about this intersection, which was just is, when we have fire and heat, and what are the implications of that. I hope you've seen something like this before, or maybe we've all sort of seen it. This is data that I pulled from CDC Wonder, which is mortality data. But this is just looking at those weather-related causes of death. And what you can see for me is two things. One, heat outweighs everything else massively. And then in addition to that, that looks like almost a really beautiful regression line that you just want to draw over the top of those bars, which is we're seeing not just those effects, but those effects are increasing. And then for today's talk, we're looking at the red bar, but we're also looking at the white bar, at the clear bar, which is fire, and some of the implications for fire. I just stole this from Mike Crimmins, who's over in Klimas. And I thought, well, maybe we can talk about climate change, but maybe we should look at what fire is. And Mike looked back at fires that have happened Arizona and New Mexico, specifically looking at the total area burned, the number of fires, and the average size of the fire, just trying to understand what has been changing, what's going on with fires. And what you see, the two red dots indicate a significant increase. And that blue line again is we're looking at. So in Arizona and New Mexico, total area burned is increasing. Number of fires looks like it's increasing, although that's not significant. But the average size of the fire is also increasing. If you're into it, he breaks it down by fuel type and other information. But it's just kind of, and then some of the factors that are driving it. So we're kind of looking at that, and then we're using this in combination. So this is some of the work that Harrison, Ladd, and I and Pima County have been doing, which is trying to understand um, what, how has heat been changing over time, and do we see any increased trends in heat over time? And this is for all of the U.S. And what you do see is that there's about a 5% increase in the total number of heat alerts. And then there's also an increase in the number of months that are seeing. And Harrison made this graph, and I kind of like it, that we're seeing, I guess the way to kind of look at it is over time, we're seeing a cone shape, which is more months are being affected, and a reddening, which is more. And this is looking at counties that have these heat alerts. He's also in the process. I don't have any statistics to put behind it just yet, but he's also in the process. This is for Arizona only, looking at excessive heat warnings. So I guess what I'm setting us up for is, we have climate is changing. If we think about that, what are the implications for health? We're seeing more fires, we're seeing increased warming. So what does that mean? What does that mean for public health? And so this kind of comes of this is hopefully I've got a thread through this for you. I worked to be able to do that, but it is kind of a little bit of pieces in different directions. So forgive if the thread doesn't fit for you. But one of the questions that we were getting, and this is you can see it's got Lad and Erica Ostoff, who's also at the University of Arizona, and then Dan Ferguson, who's in Klimas, and we get asked the question of, okay, well, we understand respiratory effects of fire, but what about there's more and more evidence that's suggesting that cardiovascular disease is also influenced. And so Erica and I, with Lad and Dan, did a systematic review to look at well, what does the literature tell us about cardiovascular disease? And what we're seeing is the black vertical line is a line of no effect. And then you can see is studies that are able to distinguish between the fire types and are attributing the fire being the structural fires or peat, these sort of smoldering fires. Those fires were significantly associated with increased ED visits for cardiovascular disease. But the vast majority of fires either don't describe it or they actually either don't. The vast majority of fires do not describe their fuel type. And on those that don't describe their fuel type, and that we didn't see an effect. Right? There was a non-significant effect of what was going on. And so this kind of ties back to the work that Mike Crimmins is doing of looking at the different fires and trying to really understand if we want to get as these more indirect or these sort of more complex associations between the health impacts, then we have to really understand the fires a little bit better. And so we're focusing on that right now. This is a collaborative work that's Shui is a graduate student at the University of Arizona, but it's also with two collaborators in France. And we're trying to, they're fire modelers. And so the idea here is, can we reconstruct the fires to be able to tease out, what kind of a burn is it, what's burning, and what are the health implications? And then kind of move forward in trying to say, okay, does the fire type matter? And what are the implications that we'll see in terms of ED visits for which diseases? Lad mentioned multiple hazards, and kind of that's where it starts moving us into. This is also work that's ongoing. So please don't quote these slides just because we're not quite there yet, but we're getting real close. But what we decided was this was kind of trying to understand that these things aren't happening in a vacuum. So I'm not responding just to heat or I'm not responding just to wildfire, but I'm starting to see more of these things happening at the same time. So we took the FEMA disasters data set. It's at the county level. And what you can see here is in the light colored bar, we have more than one. So the dark bar is single hazards, and this is looking at single hazards over time. And when we're not including heat and we're looking just statewide, we're looking at just specific counties, not including heats, we really don't see an increasing trend over time. However, when we add fires into it, we do start to see an increasing trend where counties that are dealing with something else, once you add heat into it, they're dealing with a lot more events overall, a lot more dual events happening at the same time. So we are seeing that we have more of these same have counties having to deal with more than one hazard of different types happening in the same calendar month. So this is work that Bailey's been working on. This kind of gets into, so we're talking, we can, in my mind, we can kind of talk about hazards happening at the same time. Again, time in that previous unit was in the same month. Or we can talk about events that are cascading. So a fire that a few years down, or not a few years, down the road yields a flood. And so that's what Bailey is specifically looking at. And she is starting to see an increase in one, the number of fires, well, in the number of fires that are happening with a flood subsequently in that same year. So again, unit is this one, the unit is over a year, and we are seeing a trend where more and more of the fires are resulting in or are associated with the flood happening in the same month. Now, we'll get into causality later. Right now, it's really just looking at these happening, like is this sort of something that happens, and then trying to understand it. So then that brings kind of to the message of this talk and really trying to understand moving forward. Again, this is really, for me, really special work because it comes from the questions that we get, which is we were talking with our brace partners, and they're like, okay, well, if we have this landscape of increasing fires, and we have this landscape of increasing heat events, well, how are we supposed to respond? And what is the public health response? Because as many of you on the call know, is public health is the go-to for anything that's health associated information. And yet, when it comes to wildfires, that usually sort of sits into a different, it might be emergency management, or it might be, fire response, fire chiefs and fire departments, Forest Service are dealing with it, and yet public health has to field the questions about it. So we thought, well, ask the experts is the first best way to kind of do it. So we did a survey and we spoke to, you can see the white counties are the ones that we ended up talking to. And those are counties that were experiencing wildfires that we could ask them for their input as to, what is your response and what does it look like? And we did this in both Arizona and New Mexico, trying to get our sort of local response to it. And a couple of things, and the one that really has me, and I suspect that some of you have also dealt with it, is one, we're seeing these sort of multi-dual hazards that are happening. We have these overlapping hazards, but when we have the overlapping hazards, we have conflicting messages. And this is really important for public health, of course, because one of the biggest things that we see public health being able to do in some of these situations is a source of information and pushing out information about what people should do. That clear, consistent messaging is really important for the public to be able to know what they're supposed to be doing. We can't have academic, convoluted messages when they're going out there. It has to be clear and consistent. But when we have these dual hazards, which we're expecting to see more and more frequently, then what do we do about the messaging if they have, if heat tells us to, if you don't have air conditioning, open the doors and let the air flow through. If fire tells us, close the doors and seal down, close the windows so that you don't get smoke. The other messages that came through is that public health has a really strong role in reaching underserved populations. There was a lot of, public health doesn't go out and put out the fires, but they do connect people who are being moved into resources rather than providing the stuff, but helping people find the resources. And that kind of gets us thinking that really, as we as academics can sort of start thinking about, how do we support that dual messaging and try to understand that? So that's kind of where we're at is one, it's an important question to all of us. We're seeing more and more of these hazards. We're expecting to see hazards happening, dual hazards happening at the same time. Where we can see that public health is extremely engaged and able to provide information is definitely a source that people look to. But so how do we message that? And this kind of, in my mind, tags to some of the work that we had done before, which was, okay, if we know that we have to do these things, how do we motivate people to act, especially when we're thinking about these sort of climate influences? So this was work that we did a couple of years back. which was a nationwide survey asking people about their experiences with climate change and trying to kind of think about what are the implications and what does it mean. And we sort of, for me, I kind of divide these into, adaptations where there's questions about, are you doing these things? Do you wear insect repellent? Do you reduce activity when it's really hot? Do you wear sun protection? Do you check air quality in an app or something like that? Do you bring water when you're doing? And you can see that the blue bar is, yeah, I'm doing it. I'd like to do it. I'll start doing it soon, or I'd like to do it, or not at all interested in doing it. And a lot of us are doing a lot, like these messages are being heard. There's a lot of autonomy. I can do these things. It's just me putting on sunblock. Nobody else has to, tell. So that is a message that we can do. Um, there we go. Sorry. But what people aren't doing is more of these, what I consider kind of mitigation, these sort of activities that actually really help reduce it. And you can see here that the doing bar has significantly shrunk in terms of like we don't do public transport, we don't do water harvesting, we don't do solar panels, we don't have high efficiency vehicles. Although there's a lot of that green bar of I'd like to do it. Right. And often, as you would imagine, that boils down to having the finances to be able to do a lot of those things. So the next kind of thing that we asked is, what people think about when, this global warming problem that we have about it being something that happens in the future, and how does that influence people's response? And so what we saw is that if I believe that it's happening to me, if I believe that it's happening now, I'm most likely to be engaged in something. But if I think it's a problem for later, I really don't. I'm kind of, it's not my problem. Someone else can deal with it. And they're engaging in fewer activities than those of us that think that it's happening now. Which kind of brings us back to that sort of messaging and thinking about, what are some of the things that we can do to get people thinking maybe about some of those mitigation activities and sort of promoting things and getting people moved more in that direction of engaging with those activities. And again, this kind of is, maybe we focus on those mitigation policies that also have health benefits. We think about community design, and given who all's on this call, that makes me really happy that you guys are doing that and hearing this kind of thing. And then really, I think there's still some work to be done on trying to understand what kind of things we can do and how to cost out the benefits of these activities. And that brings us to, you know, we- we're facing this landscape where we're having multiple hazards. We're seeing more of them. They're happening at the same time, or we're seeing more of these cascading events. There is an obligation to respond because of public health being such an important source of information. And what we see is that when it comes to the human side, when it comes to the community side, it's really, if I think it's happening to me, if I think that I can have an impact, I'm more likely to be able to do these things. When it comes to kind of those mitigation activities, again, it's that autonomy thing. If I can choose to take public transportation, or I can choose to have a plant-based diet, and those are the most common activities. But interestingly, for a lot of those things, economic was the biggest reason. So sometimes, even if the implications are probably beneficial for health, sometimes it's the economics that drive it. And with that, I leave you with this beautiful picture that's probably closer to some of you than it is to me. And I'm happy to take any questions if there are any.
Thank you so much, Heidi. All right, we'll open it up to questions. I didn't see any in the chat, so I apologize if I have missed any. I don't think I have, but we will certainly open it up. You're getting a lot of applause. That's great. So yeah, feel free. If you have a question, you can either put it in the chat, or if you'd like to raise your hand or unmute yourself, that would be great. Just to go ahead and get us started. So, all right. Can you talk a little bit? I don't see any right away, but can you talk a little bit about the intersection of extreme heat and wildfire smoke, as far as maybe conflicting advice? Um,
Yeah.
I know it's kind of a topic that's taking place probably in different places around the country right now with the Canadian fires and whatnot. So, and it doesn't vary actually across the country too.
When we were doing our, so it kind of came out in the key informant interviews that people were saying, like, here's a problem that we're having is we're seeing these, and we're pushing forward. A lot of times, it's we get information from the CDC and we push it forward, and those messages that get pushed forward are single messages. So we went into the literature to try to find anything about prioritizing it, and we found one paper out of a group, interestingly, in Canada, where they found this sort of at least just acknowledging that there is that conflict. And that's that one that I used as the example, which is, in I think maybe for us it's a little bit different because we have a lot of AC, but in some of the, Flagstaff further where a lot of the wildfires are happening, as they're starting to get more heat, the messaging that goes out is, if you don't have AC, open your windows and get a cross breeze. And the messaging and then, the very next message that comes out is, hey, you're having fire, close your windows and seal up. And you can do a HEPA filter and you can filter out your air. And it's, phenomenal advice on both sides. But there's really nothing that says, okay, how do I, whether it's for the community member or even for public health, like for even the person that's passing the message forward, is which message should I send forward? And how, and when the person receives the message, which message do I think about and sort of figure out and try to deal with? And I don't think that's just unfortunately something that I think we really need to work on, that we don't have a good answer for that yet.
Thank you.
Stinknet. I don't know. Um,
Yeah, so it looks like Alexa has added a question in the chat with regards to incorporating or addressing health risks of noxious weeds contributing to wildfires. Yeah, that's a really great question.
yeah, I can't answer that. I think in one of the things that I found interesting when I was looking at Mike Crimmins' paper about the wildfires is there's a shift for as these it's the impact seems to be happening, if I'm remembering correctly, more in the coniferous and shrubs, the grasslands, it's less of the wildfires are happening in there. So really the problem's kind of happening in these bigger forested forest fires. Sorry for the, dual. So for me, I think of stinknet as being, here in my backyard, or out there. And so that's more in the shrub, but I don't know. I don't know. But to that, I think that kind of goes, and maybe that's why you threw that in there. I think that goes a little bit more towards the my current struggle when we're thinking about, as someone in public health, when we're thinking about what is a wildfire. Um, it If we're measuring only or primarily in smoke days and in PM 2.5, we're not capturing what you're talking about here, which is that caustic smoke, that what burns. And really, I think we need some space to be able to like tease out a little bit more of not just that there's an irritant, but that type of irritant might really be driving what the potential health impacts are.
Okay. Oh, I see Irene has made a comment, it looks like.
Awesome.
Oh, Kat. Hi. Kat Lambrecht. She is one of our ASU communication researchers.
Awesome. Hi, Kat.
Hi, Heidi. Thanks so much for the presentation. I have a question, something I want to pick your brain about. So I just got back from collecting eye tracking data about wildfire and AQI infographics in Nevada. And what we found with our participants, and this was just last week, so we're still working through it, but what seemed to come up over and over again when we asked people both, what did you remember? Like we'd show them an infographic about AQI and then show them a black screen. It was almost always novelty, right? So they'd be like, oh, I remember, this type of filter because I don't have it in my house. And so I was curious about it.
Oh, interesting.
Almost like all of the things they'd heard already just like fade into the background. And so I'm wondering if part of dual hazard communication, because that's something our team's really interested in too, is maybe presenting, like maybe the novelty of the dual hazard communication can create that sense of novelty, right? Like, have you
Yeah.
thought about wildfire on a hot day versus a cold day? I mean, I have no idea what it would
Right.
sound like, but I'm wondering your thoughts on that because we're trying to work through that.
That's a really interesting idea because when it comes to the messaging, and Australia, for some reason, has an awful lot of really nice studies on messaging as well as, the messaging themselves. And that's why I have that like clear and consistent. It needs to, not the fancy, don't tell me I need, the NSER, blah, HEPA, blah, 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 like not the science of it, just like, mask up, close your window, open your, and it has to be really simple. And that's the thing that people remember. And the more complicated the message gets, the more specific it gets. Like we had that, I mean, it's the same COVID kind of stuff as, do I need a mask or do I need the, whatever, N25, that's where like the zone out. So it is interesting to me that you're finding like, but I can see that as I've seen that message before. It's already, in there, but will it, that's a great question of, do you think it will replace and create confusion or will it like, oh, this is new. Wait, oh yeah, I got that. Like, does it bring me back to, and when there's a wildfire, what do? I do this. That's a really interesting question. I don't know. Um, but I think I guess where I would be worried is, or I don't know if that's the right word, but if as long as we can then go back to a clear and consistent message, right? So, if the dual is going to bring you to it, and then the dual splits back to, okay, well, if A, then this, if B, then this, not, and when A and B,
Mhm.
so I think that work to make sure that the A plus B is as simple as the A and B, then I love the idea of having dual be novel. And then I'm going to pay attention to you because that's not something I've heard before. And then I'm going to get that message again of like, this is what you do.
So
That's
maybe
really,
like
oh, what fun work you do. That's cool.
yeah, we're trying to figure it out, but maybe, yeah, that model, like you mentioned, of like come for the novelty, stay for the consistency or something, I don't know what the equation is, but certainly appreciate your thoughts and your talk. Thank you.
Yeah, thanks.
Thank you, Kat. Other questions? And feel free to put them in the chat or unmute yourself. So Heidi, one thing that we are always trying to get, like Northern Arizona University, involved in our discussions as well with regards to extreme heat. Certainly, they are seeing significant fire risk all across like Northern Arizona, and so I'm curious if you have connected with NAU and what their contributions or maybe their concerns are given where they're located in comparison to like the mid and kind of the lower desert communities.
Yeah, and you can see we certainly talked to because you're spot on. They've got really the wealth and the depth of experience of trying to deal with and even knowledge about dual hazards and trying to understand that and pulling it up. And I know that NAU is doing an awful lot of really fantastic work trying to understand it. The folks over at Klimas with Christina Green and Mike Crimmins, they've really been moving forward on that, and they do collaborate quite broadly across all of the universities. And ABOR, it was last spring, I think, where ABOR brought together. We had a conference of those that were working on the wildfires, as well as all of the universities came together to have that conversation. Because I think I mean, right, I saw that, Dave Hondula was on the call and all of the folks that worked directly. I mean, you guys work on heat, like we do heat. They do fire. Wouldn't it be great if we get everybody in the same room and having those conversations and trying to figure out, what that message should look like?
Hmm. Hmm. Yeah, absolutely. I see Ryan has his hand up. Ryan, do you
Yes,
want?
can you hear me okay?
Yep.
Yes. Uh-huh.
Awesome. I really appreciate this conversation. As somebody who's engaged with the community doing a lot of health education, you know, and also being a public health professional, how do we combine these areas of thought to where we often think of them in silos, wildfires, public health
Yeah.
intervention, and so forth. And so I really appreciate this conversation, and I wish for the continuation of this thought of this area. Right? How do we uh, use public health in these ways? But as you were describing some of the environmental hazards or has concerns in regards to air quality, I often think about water quality and the exposure to potential heavy metals, likely connected to fire retardants, as it
Yeah.
progresses downstream into the lower inland or lower valleys. Do these heavy metals culminate or build up over time in these waterways that likely our community is being exposed to. And also, in combination with potential heavy metal exposure, the sediment quality, turbidity in the water, and also fine sediments that are clogging up our waterways as a result of wildfires. Oftentimes, we think about respiratory concerns as the immediate reaction, but I'm also thinking long term in regards to environmental hazards. So I'm just wondering, any considerations in water quality. But thank
Yeah,
you.
I think that's, oh, sorry, I didn't mean to stop. Sorry. Yeah, I agree. I think that's a really good question. And I guess my only answer is yeah, let's talk. You folks know how to reach me. I'd be happy to talk, and because I agree with you. I think this is the place that we don't know. We don't know how to prioritize this. We don't really know all of those downstream, we're just kind of coming to grips with the big ones. And how do we deal with those sort of downstream? I think I mean, that's what Klimas were trying to understand. And really I like useful science from the user standpoint of being able to actually not just, say, hey, there's an association, but hey, here's an association and this is what we can do about it. I think to your point, Ryan, the that kind of just to feed into it and make us more upset about it is, if we're seeing an association of increasing fires and increasingly the fires are associated with a flooding event happening within the same year, then within a county. Mind you, they might not be, but they might be spatially, overlapping. I think that kind of has to have us asking those questions of what is being washed down. What is it, what is being washed down? How far is it going? What is it, what are the implications of it? And I think, unfortunately, um, I do think we're starting to recognize and think about those things a little bit more. But I don't think that we have any answers on that yet to be able to, give good advice. Man, I gave a depressing talk. I hate depressing talks.
Thank you for the question, Ryan. It looks like Karen has a comment and a question with regards to air pollution and climate change.
Yeah, that's where I think it's kind of to me when we did the work of like what motivates people, if if the if it's really about the action that you're trying to get someone to take, so the source of it, I think maybe doesn't matter as much as long as the individual's doing what they need to do. Um, and so maybe we can refocus or eliminate some of the confusion by not necessary. I don't know. I struggle with that because I do like if we want to move into mitigating activities, then some part of me kind of feels like you got to see why this matters. But if folks are kind of making the decision from an economic standpoint, as long as in the end, the choice is something that is positive and beneficial, then maybe we're okay with that. And so I think that like if yeah, to your point, if we say, oh, well, greenhouse gases, this is the problem, it's hot, well, this is the problem. No, what you need to do is, these are the public health things that protect you regardless, do them. I love mosquito-borne diseases. I don't like whether it's West Nile, whether it's dengue, what you want to do, I don't care. You should just dump your buckets from the water. Make sure you're not having standing water, right? We're done. We don't have to really talk about which one we're preventing. Although, like, right, that's the conflict, but maybe I care about that, right, and maybe not. Like, I don't want to get bit by a mosquito. You don't have to, like, I don't want you to get West Nile virus, but really, ultimately, I don't want you to get bit. I want you to empty your containers. I don't want you to have respiratory problems, whether we're going to talk about it because of climate change or, ground ozone, whatever. Maybe that doesn't matter. Maybe what matters is, doing the action.
Yeah, I have a response to that is that, I mean, the reason I asked that question is that I'm writing something about Trump and the Canadian fires, and he doesn't believe in climate change. So it's like, well, guess what? I mean, we walk down the street, it's climate change.
Yeah.
So I started to think, well, they're one and the same. So that points out I don't know if it's hypocrisy or the stupid, whatever, what points out that misconception. So when you start talking about, what is it, dual messaging, and I've been thinking about that because
Yeah.
I spent many years sending out messages about climate change to a general public, and it's the same as it was almost 20 years ago, in some
Right.
cases.
Right.
So
But
what's the new way of approaching?
yeah, right. Like if we talk about that's where, okay, totally biased because I'm a public health person, right? But like if we talk about um public transportation and riding your bike where it's feasible in the frame of because you get your steps in, because you get your, like maybe we'll do it. And wow, wouldn't that be awesome if that's what people were doing? Same thing with like solar panels. If I talk to you about, the economic benefit, like the payback or the, like if we package it, I don't want to argue with you about climate change. Let's just talk about these things would be really cool to improve your health. And they're like, and you and I know that that's also going to be really beneficial for the climate. Like, gosh, let's think about engaging that way. Um, yeah, with the full disclosure of, like it's not, but it is interesting to me that like what motivates the individual is my back pocket often,
Mhm.
and so like maybe we change the argument, get the action by changing the argument.
Mhm.
Yeah, but one of the things that bothers me too is that um, the publications, the media has stopped using terms like climate change. I mean, I'll use the Washington Post. They used to have a wonderful desk. I mean, a lot of you don't maybe agree with newspapers and stuff, but I do because I worked at them. And the Post had a huge staff for just climate change. And a couple months ago, they fired the rest of them. I think there's 13, 7 or something left.
Yeah.
So that's why I was thinking, well, if we talk about air pollution in Phoenix and it's not getting better and it's getting worse, let's just put them together. Um,
Mhm.
anyway, I'm sorry. Thank you
Yeah.
for your answer.
No, no, I
Good,
hear you, Karen. That's a
good question. Okay, Lad.
Yeah, Heidi, since we have you with us, although this was not the topic that you spoke on, could you talk just a little bit about the connection between climate change and vectors like mosquitoes in Arizona and some of the work, our team has done kind of looking at potentials for maladaptation and concerns about spread?
Yeah, absolutely. Thanks, Lad. Thanks for giving me the capacity to talk about vectors. Um, yeah. So if we want to talk about warming, we talk about that then shortening the life cycle of the mosquito. Whenever a mosquito life cycle gets shortened, that means she gets to have more babies and she gets to reproduce faster, and we get to build up a nice big fat abundance that we worry about in terms of the more mosquitoes, just from a probability standpoint, the more chance that it's going to bite me and infect me with something. So we certainly worry about that. And then, I mean, Lad asked the question, but we can talk about it that way, is that, and Anne, I loved hearing that you noticed that your green infrastructure was working as it was supposed to in Phoenix. I noticed that it was working the way it was supposed to down here over here in Oro Valley as well. And that kind of was like, oh, well, you know, part of that it's working is that it's, accumulating, it's taking the runoff and then it's sinking the runoff so that we don't create mosquito habitat. And I saw that Irene asked the nice question, was on the call. We did some work a couple of years back, and Lad and I are working to expand it right now, which is looking at, as we green up, do we start creating West Nile virus risk? Do we start bringing the vectors into our neighborhoods? And that sort of implications of, what does that mean? Cedars are getting hotter. We have a wonderful, which I think all of us, I like it, efficacy to the side. I like having the green infrastructure. And we do know that it's effective as well. But we want to then start kind of thinking about, or at least ameliorate the fear, or show that are we seeing a problem, and are we not seeing a problem, and what does it take to make sure that we maintain the green infrastructure in a way that doesn't end up increasing mosquito abundance. I don't know if Lad wants, it's funny that Lad asked that question, because I was fixing to text him earlier today, which is, I think we're done on an analysis of looking across. So this is a secret, everybody. But we're looking at, and I'm not finding that urbanization is increasing mosquito abundance. So we're kind of like, it's not really that landscape. So that notion, maybe, we're doing it right, at least here in Arizona, that we don't see a strong signal that as we become more urban, we're seeing more mosquitoes.
Well, and I think that's a great point for GSI specifically, because I'm not sure that is like one of the benefits that I have heard consistently mentioned, as being kind of an impact of using GSI if it's implemented correctly and maintained correctly. So that might be one we have to kind of pencil in, and that could be like a future additional like research opportunity associated with that as well.
Yeah, and I think correct me if I'm wrong, Heidi, but obviously you don't want the standing water because that creates the breeding habitat. But just the fact that we put all of this GSI next to places where people tend to walk. So it's kind of the human population is next to the places where we're collecting the water, like almost a one-to-one relationship, right? And even if they're not breeding there, it still creates a nice place for them to hang out looking for places to breed. So I think that that's kind of another question too.
Yeah. Yeah. I
I
think
think, and I
that's,
think Heidi, I liked your point a lot. That if it's not causing an issue, then there's plenty of people that are concerned about it, right? So if it's not causing an issue, we need to be able to show that because people are concerned about it. So, and
yeah,
if
I
that's
think
if
that,
that's one of the if that's one of those things that is preventing green infrastructure from being installed in places, like let's show the evidence that it's working correctly. So.
yeah. Yeah, yeah. To me, that's that NIMBY argument, right? Is like, yeah, the green infrastructure is great, but it's going to bring me mosquitoes. I don't want it. But I think exactly. If we can say, well, no, it's not. Here's the evidence that it's not. Then that's all the more one less stumbling block, I guess I would say.
Mhm. It definitely provides an opportunity for better messaging, but also the additional research to support it. Because I know a lot of communities, and Irene can probably attest to that, to get more communities to suggest and implement and create policies that support the activity, they want the data to show it. And so if we don't have that information available yet, that's yeah, definitely one of those areas that we could utilize experts like yourself to kind of support projects that can prove or disprove, those hypotheses.
Yeah, and Heidi, I saw that MJ put something in the chat
Mm.
that it's not a problem in Arizona. So, do you want to speak to the West Nile outbreak in Phoenix that happened most recently?
Yeah, we're dealing with right now. I was just on the arbovirus call from ADHS this morning, and like we had, what was it? I think it was 21. We had massive where for worse and worse, Maricopa owned something like 50% of all of the West Nile virus cases that were reported in the United States. And right now, if you look at the CDC maps, we're yet again #1 for West Nile virus, which is not where we want to be. And so, I mean, we do worry about these cases. We do have a significant human burden from West Nile virus. And sorry, and yeah, West Nile being horses and humans, but it's a mosquito-borne disease. Oh, just sorry, MJ, if I wasn't clear. Actually, what I'm finding is that the green infrastructure is not showing, like very much to your point, is not yielding an increase in, well, not necessarily the green infrastructure, but that's exactly what we're trying to test right now, looking across the Arizona, as cities, I mean, and our cities have become more green, but I'm not finding an association between urbanization and mosquitoes. So I think it actually speaks to your point, which is install it. It's not, at least what we're seeing, not yet. It's not driving mosquitoes up. And yes, it's a scary place for me to be doing research because I completely agree with you. You know, I don't want to find out that, you know, we are having, you know, green makes mosquitoes. That's so far that's not what we're having. And when we looked in the study that I was talking about earlier with Lad and Irene down here in Tucson, we did not find that green infrastructure was yielding mosquitoes. It was when it's maintained, when it's working the way that it's supposed to. That's not, you know, there are mosquitoes for sure. Some of us have gotten bit. But they're not, it's not, it doesn't, at least in the ones that we tested, it wasn't the green infrastructure that was driving what we were seeing. We had one basin that, as Lad pointed out, was he predicted what was it, north facing shaded area, parking lot runoff, that ended up having some larvae, but it didn't go all the way. It did eventually drain out and didn't go to pupa, and that's really that's what matters. So I think we are supporting the same thing that you're hearing.
It's good to hear. All right. I think Irene may have the last question or comment with regards to how to message the benefits versus the hazards.
Yeah.
So any parting statements, Heidi, that you want to leave with before we close out the meeting?
Well, no, yes, thank you. And I think, you know, I guess I felt a little bit bummed that I was giving a lot of I don't knows and felt like a negative talk, but I think what it is there's some really cool, interesting stuff that I think is really meaningful that still needs to be worked on. You know how to find me if we can if we can keep chatting about it and kind of figure out what's next and how we deal with these pressing hazards.